This podcast is brought to you by Kyoto Japan Automotive Group, a company which I've known personally for over 20 years, and your one-stop shop for tires, batteries, and auto parts. Visit their website at www.kyotojap.com for more details. For such a small country, Switzerland boxes well above its weight. Its hospitals and clinics are well reputed, with a history going back over hundreds of years, in some cases, often started by religious orders or by philanthropic foundations. Some of these establishments have developed, I nearly said morphed, but that would be inappropriate, I think, in this case, into what's nowadays called destination medical travel, a real asset and adjunct to Swiss quality. I'm in one such place today. In fact, unusually, I'm making my second interview visit in a short space of time, by coincidence, really, rather than by design, though I've been an ambulatory patient here many times over the past 10 or more years. I'm in the Genolier Innovation Hub, which is adjacent to and physically joined by a tunnel, no less, to the well-known Clinic de Genolier, or in English, the Genolier Clinic. And I'm sure some of you listening have been here or even live nearby like me. It's between Geneva and Lausanne, if you know the geography, more or less. Now, my reason for being here is to witness the press launch of the official relationship between one of Switzerland's leading private groups of hospitals and clinics, Swiss Medical Network, and the renowned Mayo Clinic of the United States of America. Now, Mayo is not only a village and a beautiful county in the west of Ireland, I've been there, it also gives its name to a hugely successful private American academic medical center focused on integrated healthcare, education, and research, and founded by two brothers called Mayo. Quite some time ago. We might hear about that later in the conversation. We'll learn all about this new relationship straight after I've introduced my two guests, who are Dr. Brian Costello of the Mayo Clinic and Professor Jacques Bernier of this house. Welcome to the McKay interview. I'm very pleased to meet you, Dr. Costello, Brian, if I may, and Professor Bernier, Jacques. It's very good to see you again. Good to see you.
It's a pleasure. Thank you.
Thank you.
Well, to be sure we hear your voices. I'm so used to doing radio.
Okay.
Anyway, Brian, please tell me and our listeners and our viewers, if there are any out there, a little about the Mayo Clinic. What do you do there? Why are you here and involved in this important project? I imagine this is not your first visit to Switzerland. What are your perceptions generally of what you've seen and your experiences in Switzerland, especially here in the French-speaking part of Switzerland? Brian.
Great. Thanks, Michael. Great to be here. So I'll tell you what I do at Mayo Clinic first. That was a multi-level question, so I'll...
Multi-level.
Yes, I'll tell you what I do first. So I'm a consultant medical oncologist. I'm a professor of oncology and urology. I specialize in genitourinary cancers. And Mayo has a long tradition of physician leadership. And so part of my role at Mayo Clinic, in addition to my clinical duties and research duties and educational duties, is to be a leader in the Mayo Clinic International space, specifically as the medical director for advisory services, international advisory services. So that's what brings me to Switzerland as part of that role, and we're very, very excited and proud to be here. Let me tell you a little bit about Mayo Clinic. As you alluded to, it's got a long tradition of excellence. It was started by happenstance over 150 years ago when a tornado went through Rochester, which was a small town.
Rochester's where?
In Minnesota. So we're in the upper Midwest. We border Canada. Okay. But we're in the lower part of that state in Minnesota. And so a tornado went through town. And Dr. Mayo was there, had set up a private practice. It turned out that there was need for medical care. So he partnered with some religious women, sisters, who lived in the area to provide medical care to people who were injured by the tornado. Turns out that his two sons then became physicians, and that was the nidus of Mayo Clinic over 150 years ago. So we feel as though we're here today carrying on the tradition of the Mayo brothers and their father. The Mayo brothers in particular were great travelers. They traveled outside of the country. They traveled to other medical institutions in the United States. They really had a humility about them in many ways, that they would actually go and collaborate and share ideas with other physicians and medical professionals to try to better care for patients, either locally or in other communities. So we really look at what we're doing here today with the wonderful announcement of Swiss Medical Network as being part of the Mayo Clinic Care Network as really carrying on that tradition now in 2025. So this is the modern day version of what the Mayo brothers did all those years ago.
Okay, so the obvious follow-up question is, why a relationship with the Clinique de Genolier, private clinic, or Privat Clinic Bethien, Clinica Sant'Anna in Lugano, that's the Italian-speaking part of Switzerland, Swiss Visio Network, I understand. After all, there are lots of other private clinics in this country and hubs and medical centers from which to choose. What impressed you about here? How did you choose? It's another multi-level question, Brian.
Yes.
I can see you knitting your brow at me over the microphone. What were you actually looking for? And as I've read, you already have, and you've alluded to it already, 45 or more around the world. So tell me a little bit more about that, please.
Well, let's start at a high level. First and foremost, as you mentioned, Switzerland has a very robust medical system, very excellent medical system in terms of expertise and infrastructure. So it's a natural fit for us at Mayo Clinic. Beyond that, when we look for collaborators and members for the Mayo Clinic Care Network, we vet groups very carefully, and they go through a very careful due diligence process. We look not only for quality, safety, medical excellence, but beyond that, it's mission and values. So why Swiss Medical? It's because they check all the boxes on the quality and excellence and safety, but beyond that, they align with us in terms of mission and values. You probably will hear me say this more than one time during this conversation, but our primary value at Mayo Clinic, as quoted by one of the Mayo brothers, was the needs of the patient come first. He said that at a very famous commencement service in Chicago in the 1930s. That has become our guiding light. So what we find when we look for groups to bring into the Mayo Clinic Care Network is that it works best. In fact, it's a non-starter if we do not have alignment on values and mission. So Swiss Medical clearly is a group that is laser focused on excellence in patient care, focused directly on the patient. And that is so important. Since you asked a multi-level question, I'll give you a multi-level answer here.
I can
because I do.
I can take it, Doctor.
And you can tell I'm very proud of Mayo Clinic. I spent my whole career there, so I have a lot of passion for it. So we have 3 shields. I'm looking. I don't know if we even have the Mayo logo here for you to look at.
Those are the ones on your tie.
Yes.
Yes. Okay.
Well, I'll tell you a story about that tie as long as you bring it up. So the 3 shields of Mayo Clinic are research, education, and clinical practice.
Right.
The center shield, I'm pointing to my tie if you can't see it. The center shield is a little bigger because that is patient care. The other 2 shields are research and education, but they're all interlinked. So really we're a 3-shield practice. The quick story I'm going to tell you about this tie is that my father was a World War II veteran.
Like my father.
Yes. And was a prisoner of war in the United States and grew up poor on a dairy farm. Came back to the United States, and we had something called the GI Bill at the time, where the government would pay for education.
Right.
So he ended up going to college and medical school on the GI Bill. And actually, did his residency at Mayo Clinic.
I see.
This tie is probably 60 years old.
60?
Yeah.
Well, you don't wear it often.
This is my father's tie.
Very good. Congratulations.
I only wear it on very special occasions, so I brought it here to Switzerland.
Well, there's a lot to be said for television.
Yes.
I love those listening on radio. Jacques, turning to you. I've lived here for 40-odd years, and I know that the Swiss are pretty choosy. God knows how they let me stay here for 40 years, but I have. What do you look for at Swiss Medical Network when you choose a partner on such a grand scale?
I would say that, as Brian mentioned, I think it's not only pure medicine, it's something which is linked to more values and more values that we can share. Whatever the level, it's clear that in terms of scaling, there is nothing to compare between the Mayo Clinic and what we are doing here within the Swiss Medical Network, even if we have 22 sites now all over Switzerland. But if you allow me, I come back to the origin, actually, of this membership. In November 2022, I had the opportunity to go to Rochester with the Swiss delegation, Swiss doctors, and we spent 2 to 3 days on site, and obviously everybody was extremely impressed by the structure, by the strategies, by the operational aspects of the structure, and also by the history of the site. And so at the end of our visit, I took the liberty to keep in touch with the responsible of the International Affairs Office at Mayo. And I told the lady, I have seen your, I would say, your values, which correspond actually to our values, mainly in Switzerland and also more particularly in our institution. So could we try to see if we can build something together? And she told me, yes, but it will take a long time. And indeed, 3 years later, we are here around this table. But I would say these 3 years were actually full of rich exchanges, extremely deep, I would say, investigations. And it was very, very interesting for us because we reviewed actually all aspects, not only in terms of clinical procedures, not only in terms of scientific ambitions, but also all the aspects you know very well in the States. That means legal aspects, conflict of interest, and for us also it was really a co-construction. It was not taken as an investigation. It was taken as a construction of, I would say, an alliance which could be certainly fruitful for us and hopefully fruitful also, and maybe full of good surprise for the Mayo. So this is something that, in my opinion, is really linked to impact and trust.
Let's examine that a little bit deeper. This is a question to both of you, but you go first on this one, Jacques. What would you actually do together here? I mean, how do you make priorities? How do you choose medically, commercially, scientifically, or are there other reasons that I haven't even mentioned? You respond first, Jacques, then I'll come to you, David.
Yeah, all.
Brian,
actually, the answer is all. All the aspect you mentioned. That means that you have strategies, you have operational opportunities, but also constraints, and you have also sustainability. So all these aspects put together make that you have priorities according to your size, to your human resources. You mentioned the cost of healthcare in Switzerland, which is an important parameter
we're going to come to that,
for choices we have. For instance, and you know very well as medical oncologists, the cost of some chemotherapy or immunotherapy drugs, and we face the same problems here in Switzerland. So priorities are guided by these financial aspects, but above all, I would say we listen to what the patients tell us and what the doctors, our doctors, advise us to do or not to do.
Brian, do you want to add to that?
I do. And I agree with everything Dr. Bernier said. Additionally, it's like any other working relationship, how you set priorities. You can't do everything at one time. So it's a staged relationship, if you will. It's going to go deeper. We're going to learn more about each other and decide what the new avenues are in the future. That's the organic part of it. Where we're starting is with practice initiatives. So we're starting with executive health and wellness checkups. The second is we're starting with a collaboration around ophthalmology. And the third thing is enhancing the nursing service line. So
sorry, just to explain, what does that actually mean, enhancing the nursing service?
More nursing education. We have actually in Mayo Clinic International, we have some dedicated nursing administrators and educators that will come in and work with nursing teams.
I see.
To help them enhance what they're doing and better what they're doing. So, which I think is so important. Obviously, medicine is not just about doctors, it's about the whole team, nursing as a profession and other healthcare professionals. So we're starting off with those three things on the clinical side. That, no doubt, as we get successes under our belt, and what we talk to a lot about, to a lot of our collaborators about, is to make sure that we're getting successes under our belt. Let's not bite off too much at one time. Then once we get those projects done or close to being done, then we can see what are the next logical steps. Clinically, are there areas of research and education where we can collaborate? So this is where, it becomes very organic, and as things unfold, then we make decisions, and it's truly a working relationship.
That's good to have that clarification. Brian, I have to ask you this because it's rare. In fact, I think you're the first physician from the United States that I've had sitting in front of me over the last 12 years. The USA leads the world in high standards of healthcare, advances in the expertise of surgeons and physicians, and the technology at their disposal and the pharmaceuticals. And yet, from what I read, health outcomes in your country are puzzling, at least to me as a layman. For such a rich country, they're not as high as one would expect. And, but correct me if I'm wrong, please, declining. Now, why? And before you answer, one instance sticks in my mind. 4 years ago, I interviewed a friend of mine, a professor at the Brookings Institution in Washington, D.C., Dr. Carol Graham, and she's one of the creators of the Happiness or Well-Being Index. And I was surprised to learn from her that the United States, the greatest economy in the world, ranks only 19th in the list of happy countries, behind the Czech Republic and in front of Belgium, your country, Jacques. Professor Graham, she calls it the crisis of despair. Switzerland, by the way, ranks 9th behind Luxembourg and ahead of Australia. What is being done to reduce the inequities in the provision of healthcare in the USA, and what do you at the Mayo Clinic in particular do? I had to ask you that question. Bless you.
Excuse me. Well, I'm not a healthcare policy person, so I can't answer the why. And I'm not a health economist, so I can't speak from those vantage points.
But give us an indication, please.
Well, let me tell you at Mayo Clinic, what we really focus on is quality and safety. So, I feel as though our outcomes are superior because of a key principle, and that's teamwork. Teamwork is what matters, and communication is what matters. So when we practice at Mayo Clinic on a day-to-day basis, we are collaborating with one another. That increases the quality, increases the safety. You do see institutions where there are silos, where those simple things, collaborating, talking to each other, working as teams, don't always happen.
Even in a hospital. Yeah.
Even in a hospital. But I'm very proud to say that at Mayo Clinic, our culture is embedded in the Mayo model of care, where we have teamwork and we have good communication.
One last question before I change tack again. Brian, what are the obvious differences in the state of health of those living here that you've noticed when compared with those living in America, where you come from, just in what you see around you?
Well, I think, Europe and the U.S. appear to have sort of the same issues. Cardiovascular disease and the rest that go with a robust economy and a Western economy and a Western diet. So I don't see much different there as compared to other parts of the world.
Okay. My guests today are Dr. Brian Costello of the Mayo Clinic in the USA and Professor Jacques Bernier of the Swiss Medical Network. And we are together in the Genolier Innovation Hub studio next to the Clinique de Genolier between Geneva and Lausanne. Jacques, let me turn back to you. Here in Switzerland, Jacques, where standards are high and medical access is more equitable, we are faced with a relentless increase in the cost of medical treatment and drugs, just the whole insurance debate. I'm sure you're very familiar, more familiar probably than me. It's a mix of medical, commercial, and social issues all wrapped up into one. But at its heart is the patient. Share with me and our listeners your views on the best way forward in that particular conundrum.
I'm not sure that I can answer in 5 minutes or 10 minutes, but I can give you
an example.
I can give you an example that
we don't often get people with your experience in front of the microphone.
No, but I'm sure that you are already familiar with the examples that I will give you. Over the last 10 years or 5 years at Swiss Medical Network, we were and we are fully aware of the problems you did mention. And since last year, as you know, we started what we call a new health system, which is the integrated care, started in the northwestern part of Switzerland, where actually we introduced a game changer. That means that instead of having separate entities, that means the insurance, the care provider, and the patient, now we put all together under the same roof. That means that there is a very strict reduction of conflict of interest between the several parties. And we moved actually from a system called the fee for service to the model of fee for performance. This in order to reduce, I would say, the number of examination procedures, diagnostic or therapeutic procedures, we are not fully necessary. And actually, we are reducing the cost, and this reduction in cost can be re-injected actually in the whole system to improve new technology and things like that. I think that the other aspect, which is extremely important, is that we are moving from sick care to health care.
And just flush that out a little bit more. What does that mean?
That means that when we are talking for the time being in terms of health care, is mainly or in most cases to treat a disease, which is obviously prevailing in our activities. But I would say what we want to implement, and we are, in my opinion, succeeding in this, is to promote preventive care, preventive medicine, with some instances. For instance, we have the biomarker for chronic diseases like diabetes or renal failure, cardiovascular disease, where if you are monitoring the situation with those biomarkers, you have better possibilities to predict the evolution of a disease and to actually see exactly at what point you will have probably a worsening of the disease, and you can take, obviously, preventive measures, which are less costly than to wait for this worsening of the disease and have probably more costly drugs and things like that. So preventive medicine for us is one of our priorities. And it's clear also that the third domain with ophthalmology and with oncology, where we have this specialty, is the priorities that we will try to develop together with the Mayo Clinic.
This question, thanks for that very helpful answer, Jacques. My question is really for both of you, but I'll come to you first, Jacques. I speak with some personal knowledge and experience because I've been a cancer patient on and off here for about 15 years, and you, Jacques, were my doctor, and I shall always be grateful to you for your care and attention and good advice. My question is, what are the new peaks in medical science that still need to be conquered? What part in the important theatre of medical progress is this new medical network and Mayo Clinic partnership likely to play in that? And how do medical research institutions like both of yours decide which medical science peaks to climb? Because as you said earlier, Brian, you can't be everywhere all the time. Jacques, you kick off first on that one, and then we come to Brian.
Again, it's not. It's a multi-level question. So
yes, I do a lot of them.
To answer very simply, yeah. I think that, and I know that at Mayo Clinic, neuroscience is one of the strong
neuroscience
points. Yeah. And I think that decoding brain diseases is probably one of the main priorities wherever in the world, because. For instance, in terms of Alzheimer's disease or dementia, I took under your control, despite all the efforts that we have put forth, progresses and advances are really, really limited. So decoding the brain disease is probably a first priority. You mentioned cancer, and I think that obviously an early detection of cancer, whatever solid malignancies or leukemia or other diseases, is something that probably we have to improve in terms of diagnosis. And it's clear that the functional theranostics, for instance, with early radioactive material are very, very useful to have, for instance, a difference of 6 months or 1 year compared to a classical and conventional diagnostic procedure. There are other peaks, as you mentioned, and I think that the one of the domain where we have to be extremely cautious is artificial intelligence, and we have to be sure that AI is trustworthy in the field of medicine.
That is a huge one to open up to. I don't think we can go down that road today, but thanks for mentioning it. Thanks for mentioning it, because it is very, very important. In fact, I've got an interview coming up in the next few weeks with the professor at EPFL on artificial intelligence. It's a massive topic. Yeah. The problem is just editing my questions.
Yeah, but I'm sure that Brian has other answers.
What's your point of view on that?
Yeah, so I agree with Dr. Bernier. I think that there are big mountains, but many of them. So part of that depends on institutional expertise, personal skill sets of the people working in an institution, which mountains you decide to climb. And also in terms of collaborations, where are the synergies with other medical institutions that one is collaborating with to help climb those mountains. There are many important mountains in medicine. We can't climb them all as a given institution or a given individual. So it's where is your skill set, or where is your team skill set, or where is your institutional skill set? I would just add that I think predicting disease early based on genetics, and in my world, prognostic biomarkers are really important because this is a human endeavor, obviously, and it sounds like you've lived this. The uncertainty that people live with is probably one of the biggest things that goes along with cancer, especially cancers that are so-called curable. But this is something that somebody lives with now for forever, even if they have no detectable cancer based on our standard imaging and other things. So we need to help patients understand what their risk for disease is in the future when they're younger. But B, again, in my world, how do we help people with prognosis? And it's not just dichotomous, you have X amount of time or Y amount of time. It's helping them live in that space of excruciating uncertainty. And I think that's really our duty in many ways, is to help people along that journey.
Yeah, your words have a particular resonance, Brian. Last question to both of you. I'll come to you first, Brian. What have you learned by being here in your contact with the Clinique de Genolier and the Swiss Medical Network? I mean, the whole group, the team. What knowledge and lasting impressions will you take back home with you?
First and foremost, the incredible team that's here. I read about Swiss Medical before I came. I read their mission statement. I read about their bricks and mortar. But it's not until you come and really meet the people that you really understand what a vibrant place this is and the passion people have for really excellence in patient care and for advancing the science. That is so important. Speaking of bricks and mortar, the Innovation Hub is just breathtaking. It's jaw-droppingly beautiful. So it's really been an honor and a pleasure to be here.
Jacques, I have much the same question for you. You've had a long career, but what have you learned thanks to this particular relationship with the Mayo Clinic that has made the strongest impression on you?
The strongest impression is the red thread that the Mayo Clinic succeeded in develop over decades with the three main objectives and achievements. That means education, which is the basis of everything, clinically speaking, and in terms of science also. In terms of clinics, obviously, where you have, and it is documented each year in the polls and things like that, you are the first hospital in the world. And so this is something which is not only for a couple of years. No, it's a tradition. Mm-hmm. And in terms of research, I think that obviously there are investment which allows you to have a diversification of your domains. But I think, and I'm sure that those researches are well conducted. And again, it's a call from patients which is guiding what you are developing. And I think that the true way to conduct research. You know, we are not conducting research to do research. It's not the point. It's to increase and improve the care that we are giving to the patient. And the model of centered patient will remain and will be boosted by our partnership with Mayo Clinic. I'm quite sure of that.
Thank you. Well, we cast a light on many very interesting and thoroughly deep topics today. Thanks to both of you for your illuminating answers. I'm sure the listeners and myself wish you the greatest success in your joint effort. Brian, do enjoy the rest of your stay here in Switzerland. And my guests today here at the Genolier Innovation Hub next to the Clinique de Genolier have been Dr. Brian Costello, visiting from the Mayo Clinic in the United States of America, and Professor Jacques Bernier of the Swiss Medical Network. Thank you both, doctors.
Thank you, Michael. It's been a delight.
Thanks for listening to the McKay Interview podcast, brought to you by Kyoto Japan Automotive Group, a company which I've known personally for over 20 years, and your one-stop shop for tires, batteries and auto parts. Visit their website at www.kyotojap.com for more details. And you can find more podcasts on Anchor FM. Just Google McKay interview, Anchor FM. Thanks again for listening.